Wisconsin's COVID-19 surge this fall is testing the limits of the state's 134 hospitals. But it's rare we get a look at what's really going on inside. FOX 6 investigator Brian Polson takes you to the front lines of this pandemic inside an intensive care unit just converted to treat COVID patients who can no longer breathe on their own.
No matter how much protective gear they put on,
we are right in the face of COVID.
Critical care workers are not immune to fear.
It is very dangerous and it is scary.
When we first started taking care of COVID patients, my wife didn't want me to come home.
Still, day after day, they go to battle with a deadly airborne virus.
It's nothing that I've ever seen in my 15 years as a nurse.
On the 4th floor of the UW hospital in Madison, a multi-million-dollar wing meant for brain surgery patients was recently converted into a COVID-19 intensive care unit.
We've had to make a lot of changes in the hospital to accommodate COVID.
Thanks to medical privacy rules, we can only show you what happens in the hallways, but the real human drama is inside the rooms.
We use medications to paralyze every muscle in the patient's body so that the ventilator can take over complete control.
To keep patient contacts to a minimum, equipment that's usually placed inside the room is strung outside.
Patients on ventilators have the controls sometimes outside the room. Their IV poles may be outside the room.
And family members are not allowed.
Very strange. It's really difficult for patients.
That means doctors and nurses in full protective gear may be a dying patient's only human contact.
You have the mask on, they can't understand what you're saying half the time because they can't read your lips.
In her first year as a respiratory therapist, Sammy Linscheid admits she was underwhelmed when the pandemic first hit last spring.
I was like, well, we don't have that many COVID patients. It's not that bad.
And then we had a decent summer.
But veteran nurse Janelle Raven says all of that changed this fall.
It's just been totally off the wall.
Even at the peak of the first wave in April, there were barely more than 440 COVID-19 patients hospitalized all across the state.
It's hard for me to understand. Yes, I want to follow these guidelines, but the hospital's not horrible.
Now, even after a recent drop, there are nearly 4 times that many.
Now, it is horrible.
We have more than 4 times the number of patients with COVID-19 in this hospital than we did during our initial surge back in March and April.
Dr. Jeffrey Potoff can hardly keep track.
6, 8.
Of all the wings they're now using to treat COVID-19 patients.
11 wings in our hospitals right now have been converted to take care of COVID patients.
But it's not just rooms and beds that are in short supply.
We can't create more staff, and particularly critical care staff.
Healthcare workers are running on fumes.
I don't have a magic button or a magic wand that creates more critical care doctors, critical care nurses, respiratory therapists.
And it's exhausting. I mean, being in the ICU, the vents are constantly alarming. Patients are constantly decreasing their oxygen.
And yet the exhaustion is not the worst part.
The toughest moments for me are always the moments before the patient goes on life support.
It takes a lot out of you.
I'm doing a lot of hand-holding, reassuring, drying tears. I've prayed. Those are the tough ones.
In the final month of 2020, there are finally signs of hope.
The vaccines are coming.
But there is still plenty of concern.
I'm worried that we're going to see more and more of this as the winter goes on.
If we were to see another huge surge with Thanksgiving, that could overrun us in the next couple of weeks. If we don't see that big surge, maybe we make it to Christmas.
In other words, it's far too soon for Wisconsin to breathe easy. Brian Polson, FOX 6 Investigators.
UW Health says COVID-19 patients are filling about 12 to 18% of their inpatient beds, or nearly 1 out of every 5. The rest are still devoted to those battling things like cancer, strokes, burns, and heart attacks.